That's your right jugular vein, left jugular vein, right subclavian vein, left subclavian vein, thyroid vein, all joined to form the superior vena cava, which enters in the right atrium, right? Again, when we're talking pulmonary, which is lung supply, right? Blue is pulmonary artery, left pulmonary artery. Red is left pulmonary vein. They're backwards, okay? Because we're bringing oxygenated blood back to the heart. This returns to the left atrium. This leaves the right ventricle, okay? Down in the bottom, we have the left and right iliac veins, left and right gonadal veins, left and right renal veins, all joined to form the inferior vena cava. Okay? It's inferior vena cava from the joining of the two iliac veins up. It also enters the right atrium. Okay? That's your veins. Pretty good? Any questions over them? Arteries. Here's our heart. Here's our arch of the aorta. It arches down and back. 3 branches off the arch of the aorta. We have the brachiocephalic trunk. We have the left common carotid artery. We have the left subclavian artery. Those are 3 branches off the arch of the aorta. The brachiocephalic trunk gives rise to the right common carotid artery and the right subclavian artery. Carotids give rise to the right thyroid artery and the left thyroid artery. Okay? Our subclavian arteries become the axillary artery in the axillary area. It becomes the brachial artery in the arm. When it gets to the elbow, it splits into the radial artery on the lateral side, ulnar artery on the medial side, and joins back up into the palmar artery. Okay? You have right and left. Same artery, it just as it goes through different areas, it's called different names. Okay? Arch of the aorta arches down and comes back. It becomes the descending or thoracic aorta. Make sure you write that, okay? If I have this tag, you either write descending aorta or thoracic aorta. Either one are correct. But don't write descending artery. That's not what it is. It's the aorta. Once it passes the diaphragm, which is this dome-shaped muscle, it becomes the abdominal aorta, and it splits into the right iliac artery, left iliac artery. Once it passes the inguinal area, it's the femoral artery. Okay? First branch off the abdominal aorta is our celiac trunk. Celiac trunk has 3 branches. Gastric goes to the stomach, splenic goes to our spleen, hepatic goes to our liver, which is right here. So it's gastric, splenic, hepatic arteries. Okay? Second branch, superior mesenteric artery. And we have our right renal artery, left renal artery. We have our right gonadal artery, left gonadal artery, then our inferior mesenteric artery. See that trunk, superior mesenteric, right and left renals, right and left gonadals, inferior mesenteric, right and left iliac artery. Okay? Any question? We good with that?
Mm-hmm.
So we'll be ready for the quiz next week.